I guess I've been licensed as a mental health professional for about 35 years now. And I've been around the neurobiofeedback universe for at least 30 years. Long enough that I know a lot of the principles, the guys who sort of brought it from research to where people in clinics can be using it to help their patients, to help their clients. I guess I first really started in the field. Started with a meeting at a CHAD meeting. I was working at a hospital. I was in hospital administration, and I ran in an inpatient setting. I ran a children's psychiatric unit, a teenage adolescent psychiatric unit, and an adolescent chemical dependency unit, and a day treatment program, and had a fairly big area of responsibility. And at night, I ran a support group for parents with ADHD kids, a CHAD group. And there were about 120 parents this one night, and I did my lecture, whatever it was I was talking about at the time, medications or school interventions or whatever it might be. And one of the parents stood up. I knew her and liked her, and she stood up and she said, "Hey, Doug, what do you think about this treatment for ADHD that was on TV out of Los Angeles last night called brainwave biofeedback treatment?" And in front of all these parents, I said, it doesn't work. And she said, how do you know it doesn't work? And I actually said this, because I know everything there is to know about the treatment of ADHD, and I don't know anything about that, so it doesn't work. And what she said next really changed sort of the course of my professional life at that point. She said, "Doug, we love you, but your ignorance of the subject does not make you an expert in that subject." And so I had to confess she was right, and apologized to everybody. And the very next day I picked up the phone and I called the man who had been on TV the night before. His name was Siegfried Othmer, and he and his wife Susan had moved out from back east to Los Angeles and were really moving the field of brainwave biofeedback as a treatment that could be done in a clinical practice, moving it forward. Siegfried was a physics professor at a university back east, and Susan was a nurse, and it had really helped. Their son, Barry Sturman, was doing research with brainwave biofeedback to help people with seizure disorders and teach them how to not have seizures. And so that mattered to their family tremendously, and it helped their son a great deal. So they moved out to Los Angeles. And because Siegfried was a physicist, he was really good at understanding this whole field of brainwaves and the physics of it, and how to get the feedback to the client fast enough that they could learn to change and control their own brainwave activity. And then he was smart enough to be able to get the right software engineers in and turn it into video games that any client of any age, 6 years old and up, could play and learn how to change and control their own brainwaves. So Siegfried heard my story and he said, "Come on down and let's have lunch." So I went down to LA and met with him, and he said, "I have a training next week. Why don't you come and see if this is for you?" And I did. And it was spectacular. It really helped. It helped about 70% of my private clients learn how to change and control their brainwave activity. It was really good. And that was way back in the day. That was almost 30 years ago. Then after I was working in that field, I was at a seminar in Palm Springs, and I met a man named Len Oakes. He was doing a workshop there on a new technology that he was developing, where he was putting together what you would find on Amazon now is sound and light machines, little flickering lights and little things that go boop, boop, boop in your ears. And he was taking the brainwave biofeedback amplifier and systems and marrying them to the stimulation from the glasses. So it seemed fascinating to me because it was taking learning, operant learning, out of the loop here. It was the person's brain driving the feedback. It's called the Flexic system, and I asked if I could be a part of their team collecting data for the FDA, and another month later, and I had a system and I was collecting data for the team. And it was very, very powerful. I was using it in addition to the traditional neurofeedback systems. I had 2 traditional neurofeedback systems, had a technician that was helping me with my clients, and then we got a Flexic system. And it worked really well, especially the more difficult that a case was. It seemed to help a lot, doing things that were unpredictable. Like I wouldn't have anticipated how much it could have helped somebody who had significant brain injury from an auto accident or so on. So anyway, it was great. And working with that Flexic system, Dr. Oakes called and said, hey, we noticed that less is more. So what we'd like you to do is to put some electrical tape over the lights, the LEDs that would flicker, so the light's indirect, and turn the lights way down. So we did, and we got the same great results, So another few weeks or a month went by, and he called again, and he said, I want you to put some cardboard over the LEDs. So just the photons go through. And so, okay. So we used that with our clients with some cardboard over the lights. We got the same great results. Then he said, okay, now I want you to put the glasses on the table with the cardboard on them in front of your patient. And I just kind of said, I'm not going to do that. That doesn't seem to make any sense to me. And there were some other people that he was working with who said, we know something really significant is happening here. We just aren't sure what it is. And funded him to be able to take the system to the Livermore labs near where he lived. And what they determined was it wasn't the glasses, it was the little electric impulse coming from the amplifier through the wire to the glasses. The brain was picking that up in an insulated wire, that little tiny electric impulse driven from the person's own brainwaves, but offset slightly from their dominant brainwave. So they cut off the glasses, threw them away. And for a time, then the system just had the wire laying over somebody's shoulder. And fast forward now to today, we have the system that we have now. It's the grandson of that original Flexic system that I was part of the research team so many years ago. This system today is much simpler, more elegant, more efficient, and is something that I'd really like to share with you.